Uh, so this patient, M.I., is a young man, 19-year-old African-American high school student with a history of learning disability, and he presented with a 12-month history of impaired balance, polyuria, polydipsia, reduced peripheral vision, fatigue, and significant weight gain, loss rather, as you can see. I mean, he was very obese initially and still is quite obese. And he had headaches for about 3 years and also some erectile dysfunction about 2 years. But he had normal growth. He's actually 6'2". And he had initially presented to a head and neck surgeon who had diagnosed him with sinusitis, and he had had several courses of antibiotics and about a week of steroids with no improvement before presentation to us. Otherwise, he had an unremarkable past medical history. He was on analgesics for his headache and no significant family history. As I mentioned, he's quite dependent on his parents because of his learning disability. He was 6'2", 211 pounds, quite lethargic when we first met him, and he had pallor of his optic discs, and he had no real manifestations to suggest pituitary tumor. He had some mild gynecomastia and no discharge. And his neurological exam, he was alert, reactive pupils, his eye movements were intact. He had evidence of bilateral visual field compromise with bitemporal hemianopsia, and he had 2100 uncorrected far field vision, and the rest of his neurological exam was intact. So these were his labs. He had a slightly elevated serum prolactin at 48 microgram per deciliter, a very low cortisol, as you can see, which I think may in part explain some of his lethargy. We didn't have an ACTH at that time. His free T4 was also low at 0.7 and an inappropriately low TSH. His IGF-1 we didn't have at that point. Testosterone very low, as you can see, with subnormal gonadotropin response, and he also had low urine-specific gravity in keeping with his history of polydipsia, polyuria, although he was able to largely maintain a normal sodium. So in light of the low cortisol, he was commenced initially on sort of moderate steroid replacement, and he was commenced on DDAVP.